Artificial intelligence is a reality now in imaging. Certainly it may be applied in echo, CT and MRI. One of the best or important news in this field is that we may measure any structure of the heart in very, very few seconds, both in terms of motion, in terms of function, and in terms of volumes. This is extremely important because from the transthoracic approach, with a simple probe, we may nowadays have all this data in approximately 20-30 seconds, both for the right ventricle and the left ventricle and the left atrium. A second very important point of all the news in terms of artificial intelligence are certainly the diagnosis and prognosis. With the different modalities, echo, CT, MRI, we may have, with the videos and the data from a standard of these different methods, we may have a diagnosis. It means whether or not the patient has a cardiomyopathy, whether or not there is a normal heart, whether or not there is a valve disease, and so on. This is extremely important in terms of the educational point of view and also the clinical point of view. Obviously, all these methods have several limitations. We still need to be more cautious, particularly for diagnosis and prognosis, and there are also problems in terms of the certification of different devices. However, there are no doubt that in terms of the measurements of the cardiac structure and function of the cardiac structure, we have no problems because we may be very accurate in all these definitions. In terms of diagnosis and prognosis, the certification board may probably intervene to try to define the correct certification in all these new fields.